saying the same thing, which is mea culpa. Those of us who have been developing Grand Theft Auto and everything else have in fact contributed to some of the problems we have with obesity. But now, because of smartphones and new technologies, we can be your allies and friends in offering to meet us and help their members make money, but do good as opposed to do bad. So I think it's extraordinary what Robin's message is by connecting the dots, we really can find some ways to extraordinary progress and to really attack a problem that's much, much too big. But I guess, I just wanted to make sure I understood right. You said $147 billion a year is being spent on obesity-related illnesses. Just think of that. The budget for the Park Service is about $3 billion. The budget for the Forest Service, and this is the entire activity. If we could just find a way to take part of the money that we're now spending on people who are already ill and just find a way to spend more of that money on preventive fun that helps us, boy, what a great thing that would be. Is that practical, Robin? Can the BPC effort, is there a way to sell this reality that we can, in fact, save the nation huge amounts of money by using what we already have?
Well, I think so. I think the big challenge you see a lot more in the state and city governments is nobody has new money to spend. So what they're seeing is that how do you commingle budgets? So I was out in Utah and met with the Department of Health and the Department of Transportation. So for example, they're renaming things so that they can get the funding that exists. How do you look at what I would call co-benefits? I think it's going to be a little harder on the federal side, but potentially there is. I just haven't thought it through enough. Is that the Department of Transportation, for example, if they're trying to do what's called complete streets, where all users can use the street, so you have a roadway, you have a bike path, and you have a sidewalk, but they don't call it a complete street. They call it a diabetes prevention project. And then the Department of Health, when they go meet with the state budget officers or the city or county budget officers, they are reinforcing each other that if you have a network of sidewalks and bike paths, you're going to decrease the amount of diabetic patients that you have and ultimately save money. Nobody has money for new money, so you have to use the existing money in a different way, and sometimes it's just talking about it in a different way. Massachusetts now has a interagency agreement from the Department of Transportation and the Department of Health that each of these agencies have to work together. The Department of Transportation has to look at the health benefits of all their transportation projects. California has something called Health in All Policy. So they have 19 of their state agencies, so anything from procurement to transportation to air quality also has to look at the health benefits, because the healthcare costs for the state are so huge. So they're looking at the first state for reduced carbon, but they're also looking as an opportunity to decrease healthcare costs. So I think that's happening a lot more on the state and county and the city level, because they have to spend that money, and the federal money kind of, it's not that it has to get spent as well, but they're feeling it more acutely, and you'll see a lot more things happening on what's happening in regions because they are strapped for funds. So I don't think we're going to see anything on the federal level anytime quickly, but I think what's happening in a lot of states is they're really looking at how to work with different agencies, and I would really advise all of you, if you haven't talked to your Department of Health where you are, or if you haven't worked with the state agencies where you are, they all have programs with obesity prevention, diabetes prevention, hypertension. If those trails, Blue Cross Blue Shield is not doing it out of the goodness of their heart. Blue Cross Blue Shield is looking at their bottom line. United is not reimbursing the YMCA because they think it's a feel-good promo thing. They're looking at it because, they, quite frankly, they said, we're going to go bankrupt. So I think there's stuff happen on the state and county level, but the private sector, especially health insurers, if you haven't talked to health insurers for any of your programs, or you should, because that's a real opportunity, because they realize that they can't sustain these numbers.
Derek, can I ask one more question?
Last question.
I really appreciated your comments about the crisis aspect of this. And I'm just wondering if there aren't some opportunities. We had a crisis in seatbelts, and we had a crisis with drunk drivers, and we had a number of crises which part of the approach was pulling together all kinds of disparate interests in a national long-term campaign. And I don't see that with this. I don't even see the kernels of it, bringing it together, using the media, using all the things like Mothers for Drunk Driving did, and the seatbelt. And from my perspective, it's that may be some easier ways to get to audiences that aren't on those apps, that don't have those iPhones because they're more expensive than a little cell phone, and don't maybe have regular access to internet, but they've got access to TV. And so, you know, I'm looking at that audience and thinking maybe a big campaign that would be long-term, because it never works if it's only 6 months. And so have you got any thoughts about that? Have you seen any kernels out there of anything that might be pointed in that direction?
Well, Let's Move. I mean, Let's Move was trying to do that. The challenge that you have with the federal government is, when I was there, we started, if you're talking campaign means different things to different people. So, and I've worked on a lot of campaigns, but if you think about, if you're talking media campaign, there was some, you know, the White House has no money. So my budget when I was at Let's Move was my salary. So that was it. So there was money from HHS and Ag that was used with the Advertising Council, where there's some ads that went around. So that, and then you have the Department of Agriculture and HHS launched the new food plate. That's half your plate, fruits and vegetables. I'm sure everybody's doing that every day at every meal, right? So you can get the icon, you can make it a little plate. At a daycare center, they have that at every single station of the half your plate with fruits and vegetables. There's some of it. I think that the biggest challenge is from the federal, at least from my side in the federal government, we had so many rules of how the word "Let's Move" could be used. But all of you, you know, no matter, you know, whether it's Derek or Jason or whatever, if you wanted to use Let's Move because that's an umbrella, if you said in support of Let's Move, anybody can use it. You just can't say you're a partner of Let's Move, but you can say you're in support of Let's Move. I spent probably the first 4 months of my job working out with the lawyers of how Let's Move could be used. It's starting to happen. But, you know, lots of, it's the federal government, of those of you in federal agencies, you know, we had a basic, I wanted to create a map of the United States that you could see every, you know, regardless of funding, whether you're with the Park Service or you're with your foundation or with a trail map, that you could find out what was activities that you could do or organizations, so you wouldn't reinvent organizations. Well, as a federal government, we're not allowed to share personal information. So I couldn't share, so I could send emails out to people. I could collect their emails and I could send them information, but I couldn't connect people to each other. And that is a very hard challenge of the federal government. So that's why it's important to work with partners that can do that, that don't have those same restrictions. So it's starting to happen, but personally, I think it's going to be easier if, kind of what Frank was talking about, if we picked like 10 states or 20 states and really, or 5 states, I don't care, whatever it is, and try to figure out all the partners from that state, and it'd be a lot cheaper to do a media campaign in a state. So look at there's some states we're really trying to make progress. Colorado has some great organizations, Arkansas, Nebraska, I don't know where all, I mean obviously a lot of the parks are in the west, the bigger parks, but you know there's parks everywhere, obviously here in Virginia and North Carolina, is how do you get all these partners to the table, or that maybe collectively they can raise money. But if you've ever run coalitions before, the biggest challenge is not everybody agrees on the messaging, but maybe just doing something, you know, simple like the outdoors is America's medicine. You know, I don't know, something like that would be a way to do it.
think one other, just quickly, Derek, there's a movement going on right now called park prescriptions as well, and the Institute of the Golden Gate has published a document that's in the back of the room here, looking at some of the best practices around park prescriptions. And one of the ways that that's really coming to light is using the medical community as a conduit. So while not everybody has access to a park, not everybody has access to an iPhone, just about everybody goes to the doctor. And so how is that tool being used? And so that's a conduit, and there are some very strong practices that are being done around that nationally.
Well, let me ask you to help thank